Well, our top focus story today is the massive COVID surge in the national capital. Delhi's COVID cases have broken all previous records. The capital has recorded over 17,000 new cases in a span of just 24 hours. This is the biggest one-day spike. 104 patients have died of COVID-19 in the national capital in 24 hours, which is also the highest ever deaths that the national capital has reported since the 30th of November last year. Delhi's case positivity rate, and this is extremely worrying, is touching 16%. Delhi Chief Minister Arvind Kejriwal will be holding a crucial review meeting with the Lieutenant Governor Anil Baijal today at 11 a.m. in view of the ever-increasing cases of COVID. After this, at noon, the Delhi Chief Minister will also be holding a meeting with the Health Minister, the Chief Secretary and the Health Secretary, as well as other top officials to take stock of the COVID-19 crisis in the country. Now, over 1,000 deaths have been reported in India in the last 24 hours. This is for the first time in 6 months that India has breached the 1,000 deaths mark. Dr. Sareen yesterday spoke on the rise in the death rate in the country and what it means. Listen in.
Doctor, the positivity, Dr. Sareen, one more question before I go to my other panelists, is at 16%, 15.92% at this stage. When will you reach capacity in terms of hospital bed availability at this rate?
Well, the surge is very alarming, and it is unprecedented anywhere in the world the way the rise has occurred, and we must realize this is possibly because of a very mutant viruses, and the spread of this virus is very fast. It is more transmissible. It is not something which will allow us to develop herd immunity, and also may create problems are testing and vaccination. With that in mind, I think the surge is more than we expected, and it is likely that the deaths which follow generally the case fatality, which generally comes after 2 weeks or so, we may be in for difficult times.
Well, as cases in the national capital continue to rise, so are deaths. Relatives of patients are saying that they are struggling at the moment to find hospital beds, and with the number of deaths that are rising constantly, crematoriums and graveyards are in fact overburdened as families have to wait for long hours for the last rites of their loved ones.
Families waiting for hours for the final rites of their loved ones at crematoriums, one of Delhi's biggest graveyard running out of space. India recorded over 1,000 deaths in the last 24 hours, the highest since mid-October. At Delhi's biggest crematorium, Nigambodh Ghat, the number of cremations have gone up from 15 per day to over 30. 27-year-old Gautam, who lost his grandfather to COVID last night, has been waiting since 8:30 a.m. But even after 5 hours, the last rites have not been done.
यहाँ सुबह 8 साढ़े 8 बजे से है और अभी 1 बजने को है, कोई सुनवाई नहीं है और एक एम्बुलेंस में 3 पेशेंट आए हुए हैं और एम्बुलेंस भी प्राइवेट है.
At Delhi's biggest graveyard near ITO, the JCB is constantly digging more graves and space is running out.
ऐसा है जैसे 4 तारीख से शुरुआत हुई थी, तो शुरुआत में तो ये था कि 2-3 हो रही थी, लेकिन अब 4-5 दिन से तो ये हो गया है कि 17, 15, 16 ऐसे डेली आ रही हैं.
अच्छा
है तकरीबन अभी तो 100 तकरीबन कर देंगे जितनी जगह है हमारे पास.
100 की बची है जगह बस.
हाँ जी, उसके बाद बढ़वाना पड़ेगा. जो कोविड ब्लॉक है वो तकरीबन भर ही जाएगा
अगले 10 दिन में.
हाँ, अगले 10 दिन में. उसके लिए फिर कमेटी से आगे बात करके बढ़ाएंगे.
Mortality is going up. This is because probably of late reporting to the hospital, और बहुत सारे चीज़ लोग मिस कर रहे हैं सिम्टम्स को. कोई अगर बुखार घर पे हो रहा है रिपोर्ट नहीं कर रहा है, and they are coming to the hospital at the final stage.
But many are queuing up at hospitals, say there is a shortage of hospital beds.
सुबह से हम चक्कर काट रहे हैं. सेंट स्टीफन हॉस्पिटल में मैं इमरजेंसी करवाया उधर, वहाँ कोई इलाज करवा दिया, फर्स्ट एड करवा दिया, पर तो बेड नहीं मिला था. पता ऐप के थ्रू सारा ट्राई कर रहे थे, सारी जगह में कोई सबसे पहले फ़ोन कोई नहीं उठा रहा. ऐप में पता करने के लिए बोल रहा है, ऐप में कोई दिखता नहीं है. हम तो एम्बुलेंस में लेके कितना चक्कर काटते रहेंगे.
Currently, 85% of Delhi's ICU beds with ventilators and 88% ICU beds without ventilators are occupied.
Throughout the pandemic, the Indian government has emphasized how our nation has been better at dealing with COVID because our deaths have been low. But with the second wave, the reality is changing, and it is evident not just with the numbers going up over 1,000 within the last 24 hours, but also through the scenes at crematoriums.
In New Delhi with Saurabh Shukla and camera person Sushil Rathi, this is Sukirti Dwivedi for NDTV.
Well, from Delhi, let's now shift our focus to Maharashtra. The state has recorded nearly 59,000 fresh infections in the last 24 hours. 278 deaths have also been reported in this period. Mumbai, Pune, Nagpur are among the cities that are reporting the most amount of cases. But just like Delhi, patients, their families are struggling for hospital beds in Maharashtra too. Ahmednagar, Satara and Chandrapur continue to remain the worst hit. Meanwhile, lockdown-like restrictions have kicked in Maharashtra. The state, remember, is in a partial lockdown from 8 p.m. last evening. This is, of course, an attempt to break the chain of transmission. Only emergency services are allowed for the next 15 days between 7 a.m. and 8 p.m. Purva Chitnis with the full story.
Maharashtra went into a 15-day lockdown style from 8 p.m. Wednesday. Section 144 is in place and only essential activities allowed for the next 15 days. Hussain Sheikh is driving the auto rickshaw for the past 15 years. He works for 10 to 12 hours every day. But in the last few days, with restrictions in place, he says the business has gone down. He could manage only 2 customers in 6 hours.
1000 रुपये धंधा होता था 12 घंटे 8 घंटे में. अभी मतलब 40% 60% तो धंधा है ही नहीं. वो ये जिधर भाड़ा छोड़ो उधर खाली आना पड़ता है.
But CM Uddhav Thackeray announced a financial package of over 5,000 crore to various sections of the society. About 12 lakh rickshaw drivers who have permits will get rupees 1,500 each. But Farooq Gulzar doesn't have a permit as he is not the owner of the auto. And after giving the share of his income to the owner, he is left with only 100 to 150 rupees daily, which earlier used to be over 500.
1500 रुपया का कहना जो है देंगी सरकार, तो ये जो मालिक है उनको मिलेगा जो परमिट होल्डर है. बाकी ऐसे बहुत से लोग हैं जिनके पास तो परमिट ही नहीं है, तो उनके लिए क्या सरकार करेगी.
For the past week, because of restrictions, non-essential shops were closed. This will be extended till April 30th now. Earlier, Shops Association demanded that they be exempted, but now they are ready to cooperate with the government.
हालांकि अभी जो लड़ाई है वो कोरोना की है, क्योंकि कोरोना किस प्रकार से इस प्रकार से बढ़ रहा है, हमें सबको मिलके इसका सामना करना पड़ेगा और इसके लिए हमारे को सरकार को साथ देना ही पड़ेगा. लेकिन हमारी दुकानें बंद रहेगी 15 दिन, हमारे लोग बेरोजगार हो जाएंगे, लोग घर पे बैठेंगे और उनके पास और कोई चॉइस नहीं है.
But Restaurant Association is not happy, despite the restaurants being allowed for home deliveries.
We are not satisfied with this new notification. The new notification or so-called permission that has been granted is as good as mini lockdown.
The government says it has no option but to impose this lockdown-style restrictions. The government has also announced an economic package. Now it needs to be seen whether it gets implemented on ground or not and whether people will support this or not. In Mumbai with camera person Rajendra Dayalkar, this is Purva Chitnis for NDTV.
Well, let's also now shift our focus to the other state that presents itself as a worrying situation, the state of Uttar Pradesh. Uttar Pradesh has for the very first time reported 20,510 fresh COVID cases. This is the highest ever for the state in a 24-hour period. 68 deaths have been officially reported in this time period, but there is evidence from cremation grounds, especially the ones in Lucknow, to suggest that the numbers that are being reported could actually be inaccurate. The actual numbers could actually potentially be much higher. Active infections in the state have now crossed the 1 lakh mark, with the state capital Lucknow accounting for 1/3 of the active cases. Lucknow has reported 5,433 fresh COVID cases last evening. This is the highest for the city in the 24-hour period. Alok joins us with the very latest. Alok, the numbers that are being reported at the moment, there are several question marks because if you look at what's happening across crematoriums in Uttar Pradesh, it indicates that the actual numbers could be much higher.
Well, it does. In fact, you know, those visuals from Varanasi that we probably are playing on our screens are very shocking, and they are, of course, taken from a distance, and because it was evening, you see the extent of what is happening there. We've, of course, reported on this situation. It's not new. We've been doing it for the past 3-4 days. My colleague Kamal Khan was at that crematorium yesterday, and he also sent a report talking about how, you know, the actual number of cremations that are happening, obviously assuming that some of the cremations happening there are not of COVID patients also, because there is one dedicated COVID crematorium and there's another one where other people also come. But even so, you know, I mean, just looking at these visuals, you know, it makes you wonder whether the government is hiding the true number of deaths that are happening because of COVID. In fact, we had put that question to Mr. Dinesh Sharma, who is UP's Deputy Chief Minister. And he had said, you know, yesterday that these figures are issued by the government and they are those who are admitted to hospital or have been registered at the command center of the Chief Medical Officer, that is the controlling authority for COVID infections here in Lucknow. So that is the government's justification. But as you and I will perhaps agree, and maybe our viewers too, that those visuals tell a different story.
All right. And Alok, what's also worrying, I mean, apart from the fact that we're putting out these shocking visuals on our screens, is the fact that despite the record surge in COVID-19 infections in Uttar Pradesh, panchayat polls are going to be beginning today. This is a massive electoral exercise. 4-phase panchayat elections are going to be kick-starting across the 75 districts in the state.
Well, you're absolutely right. You know, in fact, a colleague from the web team just sent the perfect headline for it, saying that UP rural polls begin amid the COVID surge today. And there are 3 crore people eligible to vote. I mean, that is indeed a massive exercise. Many in the vernacular media are calling it the semi-final for Uttar Pradesh in that sense, because, you know, the voting logistics are in fact perhaps going to be more than what you have for a state election, because here you have, you know, polling booths or voting in a lot of the villages, a lot of the rural areas, and, you know, so many people come out, and there is the sheer number of candidates, etc., makes this a very, very big logistical exercise. And of course, the worry is that, you know, at this point of time when there is so much of a COVID spread in Uttar Pradesh, the logic of holding an election like this at this point, could it have been postponed? I remember that yesterday, you know, there was a BJP MP, Kaushal Kishore, I think he's the MP from Mohanlalganj, or he's the MP from Mohanlalganj. He, in fact, sent out a tweet, I remember, saying that, you know, there is nothing more important than the lives of people right now, and that is why perhaps these elections should be postponed. But in their best wisdom, the government has decided not to do that, and the polls are well and truly underway. In fact, we have some shots also coming in from Rampur, where I saw that a lot of the voters were wearing masks, of course, perhaps enforced by the police, but there was no social distancing, and then you have the risk of events like these becoming super spreaders. So one does hope and pray that the situation in Uttar Pradesh will not go down further because of this massive voting exercise that gets underway today. 18 districts are being polled today, about 3 crore voters, as I said, and ultimately there will be 4 phases. And counting is on the 2nd of May, when the state elections are also counting.
Alok, appreciate you for joining us with the very latest. Before we move on, let's just look at those figures once again. 20,000 infections, more than 20,000 fresh infections in this 24-hour period in Uttar Pradesh. The state alone has over 1 lakh active cases, and yet there are 3 crore voters that are going to be polling in the first phase of the panchayat elections today in Uttar Pradesh. We're just putting out those facts. We leave it to you to make what you will of it. But the other big story that we're tracking is, of course, the big relief that came to students and parents who are in fact going to be appearing for the CBSE exams. After an important meeting that was chaired by the Prime Minister yesterday, Class 10 exams were cancelled. Class 12 exams have been postponed at least till the 1st of June. Amid the surge in India's COVID cases, the Central Board of Secondary Education Class 12 board exams have been postponed and the Class 10 exams have been cancelled. The exams were to begin on the 4th of May. The decision for Class 12 will be taken on the 1st of June and a 15-day notice will be given to students. Class 10 students will be promoted on the basis of an objective criteria, one that the board is still finalizing.
The announcement came shortly after Prime Minister Modi met the Union Education Minister Ramesh Pokhriyal and other senior officials.
अभी वर्तमान की जो स्थितियां जो रही हैं, हमारे देश के प्रधानमंत्री जी ने आज एक तत्काल प्रभाव से एक बहुत उच्च स्तरीय बैठक का आह्वान किया, क्योंकि हमारे लिए सबसे महत्वपूर्ण छात्र की सुरक्षा है।
Students, several state ministers and opposition parties have been demanding that the government cancel the boards.
It is definitely a relief because I also contracted COVID-19 a few days ago and it really made it difficult for me to study. Also, considering that there are lakhs of children involved in the board exams, I think we will be putting everybody at risk if the board happens.
Several states including Maharashtra, Punjab, Chhattisgarh have already postponed the state board exams. Delhi's Aam Aadmi Party government and the Congress's Priyanka Gandhi Vadra had pointed out how exam centres could turn into COVID hotspots.
हमें खुशी है कि एग्जाम 10वीं क्लास के कैंसिल किए जा रहे हैं और 12वीं क्लास की डेट्स रीशेड्यूल की जा रही हैं। हालांकि मेरा मानना है कि 12वीं क्लास के बच्चों के मन में जो एंग्जाइटी अभी बनी रहेगी रीशेड्यूलिंग की वजह से, वो भी दूर की जा सकती थी। उसकी जगह अगर उनके भी एग्जाम कैंसिल करके और एक कोई दूसरा तरीका निकाल लेते।
With a rapid rise in cases among younger population and no vaccine for those below 18, parents and students across India have welcomed the move. Rishika Barwa, NDTV.
Welcome back. Let's shift our focus to Chhattisgarh. A shocking story has come to light from Rajnandgaon in Chhattisgarh, where a garbage van was used to ferry the dead body of a COVID patient. Pictures show sanitization workers lifting the body and literally dumping it in the van. The Chief Medical Health Officer said it's the responsibility of the Nagar Panchayat. With that, we're slipping into a short break. We'll be back with more news on the other side. Stay with us. Well, Telangana's Health Director, Dr. G. Srinivas, has warned that Telangana could head the Maharashtra way in COVID infections. He says that the last 4 weeks, the COVID positive numbers have risen dramatically. Telangana has seen a spike of over 2,157 cases in the last 24 hours. This according to the official estimates.
గత 4 వారాలుగా రాష్ట్రంలో కరోనా కేసుల సంఖ్య విపరీతంగా పెరగడం మనం చూస్తూ ఉన్నాం. రాబోయే 4 నుంచి 6 వారాల్లో ఇలాంటి పరిస్థితులే ఉండే అవకాశం ఉంటుంది. ఇలాగనే మన పరిస్థితిని వదిలేస్తే మన తెలంగాణ రాష్ట్రం కూడా ఒక మహారాష్ట్ర అయ్యే పరిస్థితులు కనిపిస్తున్నాయి. అండ్ మన రాష్ట్రంలో కేసులు ఇలా పెరుగుతూ ఉంటే ఇప్పటికే బెడ్స్ దొరక్క కొంతమంది కొన్ని హాస్పిటల్స్ లో ఇబ్బందులు పడుతున్నారు. రాబోయే రోజుల్లో ప్రభుత్వం ఎన్ని రకాల చర్యలు చేపట్టినప్పటికీ, ఎన్ని బెడ్స్ అరేంజ్ చేసినప్పటికీ ఇలాంటి ఇన్ఫెక్షన్స్ కంటిన్యూ అవుతూ ఉంటే బెడ్ దొరకలేని పరిస్థితి వచ్చే అవకాశాలు కనిపిస్తున్నాయి. కాబట్టి ప్రభుత్వం లాక్డౌన్ వైపు కానీ కర్ఫ్యూ వైపు కానీ వెళ్ళట్లేదంటే పరిస్థితులు తీవ్రంగా లేవని చెప్పేసి కాదు. పరిస్థితులు చాలా తీవ్రంగా ఉన్నాయి. ప్రజల జీవనోపాధి దెబ్బతినద్దు, రాష్ట్ర ఆర్థిక పరిస్థితులు దెబ్బతినే ఉద్దేశంతో ప్రభుత్వం అలాంటి చర్యలకు పూనుకోవట్లేదు. ఇంకా వేరే రిస్ట్రిక్షన్ కూడా పెట్టాలని భావించట్లేదు. బట్ ఇక్కడ ప్రజలందరూ కూడా స్వీయ నియంత్రణ, స్వీయ జాగ్రత్తలు తీసుకోకపోతే పరిస్థితులు ఇంకా విషమించే అవకాశం ఉంటుంది. ఎందుకంటే ఇప్పుడున్న వైరస్ చాలా ఫాస్ట్ గా, చాలా ర్యాపిడ్ గా స్ప్రెడ్ అవుతుంది.
Well, Uma Sudhir joins us with the very latest. Uma, a worrying story there emerging from Telangana as well. You have officials who are warning that Telangana could go the Maharashtra way.
Yes, indeed. The indication of just the last 24 hours may not be really accurate for the simple reason that over the weekend and over Ugadi, the testing was in fact low. So we had, figures of just about 3,000, 4,000 positive cases in the last few days. But the fact is, over the last fortnight, we have seen a 338% rise in cases in Telangana, which is really, really worrying. And what the health director is pointing out is that this is the highest ever rise that we have seen. And the few characteristics of this particular rise that he is pointing out, the fact that people, when they are coming into the homes within a few hours or within 1 or 2 days, all the family members are getting infected. He's saying there's a fear, in fact, that the virus is now airborne. And for the first time, we are hearing the health director actually telling people that we have so far the recommendation was to wear a mask when you go outside, but he is telling people that even when you step inside your home, if you do not want to infect others inside the home, and if you have just come from outside, please wear a mask inside the home as well. And he's giving another warning saying that despite our best efforts, already we are seeing a shortage of beds, and that is only likely to increase in the next few days. And he says the reason the government has not declared a lockdown is not because the situation is not dire, but because they do not want livelihoods to be hit and the state economy to take a huge hit as well. So the health director putting out this video telling people to behave responsibly. This coming at a time when, of course, we are having elections elsewhere, and in Telangana as well, in Nagarjuna Sagar, a bypoll is happening on the 17th of April for the assembly seat there, and huge campaigning, once again following new protocols. And of course, we are seeing, festivals and rituals being observed by different communities in all those places, whether it is the Makkah Masjid or the Kumbh in, all those places, we have seen people not following COVID protocols, and that's the reason why the health director is saying, please take individual responsibility.
All right, Uma, appreciate you for joining us for the very latest. We'll keep a close watch on all those developments. Let's now shift our focus to Rajasthan, which is also seeing now a new set of restrictions being put in place. The Rajasthan government on Wednesday night announced an 11-hour daily curfew from 6 p.m. to 5 a.m. which starts on Friday. This is going to be implemented across all cities as a part of a series of measures to combat the worrying spike in COVID infections in the state. The curfew will be in effect till the end of the month. Other measures include closing of markets by 5 p.m. every day and a complete closure of all educational coaching institutions, factories and bus stands will be exempt from this order for now. Public functions and sporting events will not be permitted. Weddings can have a maximum of 50 guests as opposed to the earlier cap of 100. From Rajasthan, let's get you an update from Madhya Pradesh, where we have been constantly reporting on the acute shortage of oxygen amid the surge in COVID-19 cases. The government is claiming that it has doubled oxygen supply to hospitals, but it's simply not enough to meet the demand. In Bhopal, one of the hospitals has now stopped admitting seriously ill patients. Anurag Dwari reports.
This is how bad the oxygen shortage in parts of Madhya Pradesh is. The city hospital in Mandideep, just outside Bhopal, is now turning away critically ill patients like Ashok Rai on Tuesday, who was gasping for breath. Despite the government's claim of increasing the supply, the hospital says it is getting just around 30% of its requirement. The hospital PRO claimed 6 people died because of lack of oxygen.
Per day हमें 90 सिलेंडर चाहिए रहते हैं, आ 30 रहे हैं, 60 सिलेंडर रोज का।
ऑक्सीजन की कमी से मौत भी हुई है अस्पताल में?
जी बिल्कुल हुई है।
कितनी मौतें हुई हैं कल से आज तक में?
कल सुबह एक, दोपहर में 4, 5 मौतें कल वहाँ हुई हैं और एक यहाँ हुई है। 6 मौतें हुए हैं 2 दिन में
ऑक्सीजन की कमी से।
हाँ, और ये अमूमन हर निजी नर्सिंग होम में होगा। आप हर जगह पता कर लीजिए। शासन प्रशासन के भय से खुल के कोई बोलना नहीं चाह रहा है, मगर स्थिति ये कह रहे हैं कि हम उपलब्ध करा रहे हैं। तो पिछले 7 दिन में कहीं कोई गैस सिलेंडर हमारे यहाँ नहीं आया, ना डीलर आया।
The PRO was sacked after his statement to the media, but our sources has confirmed that the hospital ran out of oxygen and they could not arrange for additional stocks.
The crisis in other hospitals as well. In an unusual move, Bhopal's Neuron Hospital began taking written undertakings from the attendants of critically ill patients that they had been informed about the shortage of oxygen and that the hospital shall not be liable in case of any untoward incident. Now the hospital has stopped admitting critically ill patients.
हम लोगों के पास ऑक्सीजन और रेमडेसिविर की बहुत स्कैर्सिटी है। हमने ऑलरेडी गवर्नमेंट को बताया हुआ है, ना, परंतु ऑक्सीजन सिलेंडर्स और इसकी स्कैर्सिटी अभी भी है, इसलिए हम लोग जो है वो क्रिटिकल पेशेंट्स नहीं ले रहे हैं।
In Ujjain, the R.D. Gardi Medical College too has raised an alarm.
लेकिन ऑक्सीजन की सप्लाई अगर नहीं होगी तो हमारे लिए ये 140 बेड जो हम ऑक्सीजन के अभी चला रहे हैं वो चलाना हमारे लिए मुश्किल पड़ जाएगा। तो ये पर्याप्त मात्रा में ऑक्सीजन हमको नहीं मिल रही है।
This hospital in Madhav Nagar in Ujjain has some oxygen but no bed for this patient. The government, in the absence of any oxygen production facility of its own, says that it's in touch with the center for a continuous supply of the precious gas.
ऑक्सीजन की उपलब्धता, क्योंकि बेड्स तो मिल जाए लेकिन ऑक्सीजन चाहिए। उस पर हम निरंतर ध्यान दे रहे हैं। मैं दिल्ली लगातार संपर्क में हूं, सबसे मैं लगातार बात कर रहा हूं ताकि ऑक्सीजन की उपलब्धता बढ़ती रहे।
Amid COVID surge, oxygen alarm bells in Madhya Pradesh, and the government is mindful of the demand as per the highly placed sources, which is 400 metric tons as on today. With camera person Rizwan Khan in Bhopal, Anurag Dwari for NDTV.
Well, as COVID cases rise, especially in the national capital, Dr. Sareen spoke with NDTV on how a self-lockdown is in fact the need of the hour.
In a situation like this, is it not recommended that there is some sort of a lockdown in Delhi?
Well, I'm no one to suggest all that. I'm just a simple doctor. It will not be possible for me to suggest, but yes, self-lockdown I would strongly recommend, and everyone should and can do it. And self-lockdown is mask up, no make mistakes. Governments cannot stop pandemics. Public stops pandemics. How do we manage this? In my opinion, if we all promise 100%, irrespective of caste, creed, religion, stature, that we are going to use a mask and we use the mask in a proper manner, the spread cannot occur. There is no way the virus can infect the other person. And especially hospitals, if you wear double mask, although there is not much evidence, the doctors and the house staff can be totally protected. So in my opinion, if you all promise, and through your media, everyone does that, it will be a great benefit. The spread of mutant virus is much faster. We may not have enough time. We need new vaccine platforms. We need to develop, we have only first generation vaccines. So to prevent the spread of mutant virus, we must develop concurrently our ability to sequence, our ability to see that we can develop new vaccines.
Dr. Sareen, why do we still not know the exact strain? More than a month after the surge happened all over India. Is it the UK strain? Is it, a double mutant indigenous strain? What is it? We still don't know. We know it's all there, but we don't know which one is the one responsible for all of these numbers. And if we don't know this, how do we fix it?
Yes. See, it is Darwin's principle. You know it, Vishnu. Darwin's principle is survival of the fittest. The virus has to survive. And to survive, it has to change. And once it changes multiple times, let's say you have gone to a large mela, one person has given to other, to survive it has to change. And till now about 5,000 mutations have come, and what is now known as VOC.
Right,
the variant
of concern. Yes.
The variant of concern are few, and these mutations in the virus are the ones which are spreading fast, and that probably is the cause of our surge of the virus.
All right, and you can call us on the number flashing on your screens at 1:30 p.m. this afternoon, and we'll have a panel of expert doctors answer your questions on the coronavirus. Moving on, in his first campaign in Bengal this election season, Congress leader Rahul Gandhi on Wednesday pitched the battle between the Congress and the TMC and BJP as a battle between politics of principle versus the politics of convenience. The Congress is fighting 96 of 294 seats in the state as a part of the Sayukt Morcha.
Midway through the Bengal elections, Rahul Gandhi on his maiden campaign rally in the state. The Congress is fighting 96 of 294 seats as part of the Samyukta Morcha with the left and the fledgling Indian Secular Front led by a popular Muslim cleric. Rahul Gandhi's target, Mamata Banerjee and Mr. Modi, and the politics of principle versus convenience.
यहाँ पे ममता जी ने रोजगार दिया आपको, कॉलेज लगवाया, सड़क बनवाई। कांग्रेस पार्टी ने कभी बीजेपी के साथ समझौता किया, कभी अलायंस किया उनके साथ? नहीं किया ना? ममता जी ने किया है? ममता जी ने कभी किया?
Mamata Banerjee was once a minister in the Atal Bihari Vajpayee government. Rahul Gandhi rubbing that in. On the pandemic, however, the two were agreed that Mr. Modi had failed from the start.
नरेंद्र मोदी जी ने कहा, भाइयों और बहनों, कोरोना आया है, थाली बजाओ। ये व्यक्ति हिंदुस्तान का प्रधानमंत्री है और व्यवस्था की रक्षा करने के बजाय मजदूरों के लिए रेलवे टिकट, बस टिकट खरीदने के बजाय देश को कह रहा है घंटी बजाओ।
কোথায় ছিলে এতদিন তোমরা? আবার কোভিড লাগিয়ে দিয়ে পালিয়েছো। সব ভালো করে দিয়েছিলাম আমরা। সবাইকে যদি সময় মতো ইনজেকশনটা দিয়ে দিত, নতুন করে কোভিড হতো না।
The no-show by VVIP Congress campaigners in the first 4 phases of polls in Bengal did raise eyebrows. Was Congress top brass skirting Bengal and Mamata in case of post-poll eventualities? Adhir Chaudhary, Bengal's Congress chief, has ruled out his party backing Mamata in any scenario. Could unity on COVID change that after 2nd May? Monideepa Banerjee, NDTV.
Welcome back. You're watching Good Morning India. I'm Rishika Barua. Not so good news. Delhi is now emerging as the COVID capital of the country. It's broken all previous records. Delhi has reported 17,000 infections in the last 24 hours. This is the biggest one-day spike for the national capital. 104 patients have lost their lives to COVID-19 in this time period in the national capital as well. Delhi's positivity rate is around 16% at the moment. The Delhi Chief Minister Arvind Kejriwal will be holding a crucial review meeting with the Lieutenant Governor Anil Baijal today at 11 a.m. in view of the rise in COVID-19 infections. After this, we're told at noon, the Chief Minister will be holding a meeting with the Health Minister, Chief Secretary and Health Secretary, among other top officials. My colleague Suketi Dwivedi, who's been reporting on the details of this story, she's going to be joining us in just a bit. But this, of course, is the big development. Could a weekend lockdown or varying degrees of restrictions now be put in place in the national capital as well? Remember, Delhi is seeing an unprecedented surge in COVID-19 infections. 17,000, more than 17,000 cases is the highest ever caseload for Delhi since the inception of the pandemic. Deaths in Delhi also continue to rise. There have been long queues and long hours of waiting for people across graveyards and crematoriums in the national capital as well. Our team of reporters fanned out across Delhi are reporting that people have been waiting for long hours to in fact cremate their loved ones. We'll keep a close watch on all those developments from Delhi. Remember, there's a crucial meeting at 11 a.m. Could a weekend curfew now be a possibility in the national capital? We'll get you more, but let's shift our focus for the moment to Maharashtra. The state has recorded nearly 59,000 cases and 278 deaths in the last 24 hours. Mumbai, Pune and Nagpur are among the cities that are reporting the most amount of cases. Mumbai in the last 24 hours has reported over 50 deaths and close to 10,000 cases. Now, patients and families have been struggling for hospital beds in Maharashtra. Ahmednagar, Satara and Chandrapur continue to remain the worst hit districts. Now, remember, a lockdown-like situation has already been put in place in Maharashtra. It came into effect from 8 p.m. Throughout the course of the day, only essential services will be permitted for a period of 15 days across the state of Maharashtra in a bid to flatten the curve to curb the exponential rise in COVID-19 cases that have been reported from Maharashtra. Well, Saurabh joins us with the very latest. Saurabh, a lockdown-like situation, has come into effect in the state of Maharashtra from 8 p.m. yesterday. What are the streets looking like today? What are you picking up from the ground?
Well, the streets are definitely empty, and that's something that we are seeing across Maharashtra and Mumbai as well. Obviously, people who are engaged in essential services are going to work. Now, yesterday, we of course saw these, temporary structures coming up for policemen to sit and enforce the lockdown. And also, we've seen that in several places, there is, of course, this whole bandobast of police to ensure that people follow the norms. In fact, the Mumbai Police Commissioner, Hemant Nagrale, we had that, bite from him yesterday, where he said that Mumbai was in the middle of a war, and during war, people don't insist on their freedoms, but willingly give it up for survival. And right now, it is a matter of life versus livelihood. Yes, livelihood has been affected. The government has put in certain, mechanisms to deal with that as well by, opening up the Shiv Bhojan Thali, for example. which used to cost 5 rupees a plate, now a full meal free of cost at all these centers which serve the Shiv Bhojan Thali. Also, what you have is, payouts to certain sectors that are worst affected by this. But at the same time, the government needs more time to ramp up, facilities, because what they already ramped up facilities to are also falling short, because the second wave has seen immense, fast transmission of the virus and cases rising exponentially, as a result putting enormous strain on the healthcare system. Mumbai Police Commissioner has said that the police will reinforce the restrictions. The DGP of Maharashtra, Sanjay Pandey, also held a press conference yesterday and appealed to the people that the police have been briefed not to use force, but if it came to a situation where people weren't following restrictions that have been put in place, then the police would have no other option but to enforce it. So on the streets of Mumbai, definitely emptier than other days, but right now is also office time, and even if 20% of Mumbai is out on the streets, then you will have traffic, you will have people on the streets, because that's how the city is, and that's how crowded the city is actually.
Well,
so
Saurabh, it's going to be interesting
have come
to
into
see.
Force.
Yes.
Yesterday night.
Go ahead, Saurabh.
Yesterday night things were pretty empty. This morning there's a little bit of traffic, but again, the police are there. Police checkpoints are there to enforce the restrictions.
All right. So restrictions have been put in place. Remember, these will stay in place for a fortnight. Is a lockdown or a partial lockdown like the one we're seeing in Maharashtra the only way to stop the chain of transmission? That's the big question. Appreciate you, Saurabh, for joining us with the very latest. Let's now shift focus to Delhi once again. Sukirti, what are you picking up from your sources? There's an all-important meeting between the Delhi Chief Minister and the Lieutenant Governor at 11 a.m. Given the exponential rise in cases, the shortage of hospital beds that Delhi is seeing, is a lockdown-like situation imminent for the national capital as well?
Well, yes, the situation is definitely very grim at this point for the national capital. Day before yesterday, there were 13,500 or so cases. Yesterday, we saw over 17,000 cases. If there is going to be a jump of 3,000 to 4,000 cases on a daily basis, then it is going to be extremely lethal for the public of the national capital. And even though the Delhi Chief Minister has repeatedly said that he's never been in favor of lockdowns, because it is also a matter of livelihoods. A lot of migrant workers, a lot of people, small vendors, they suffer when a lockdown comes into place, and they lose their right to earn. So we have to look at those people as well. That's what he has said so far. But at the same time, the health of the people is also a priority. And now the way the cases are rising, this could compel the Chief Minister to take the kind of steps that he never wanted to. And today there is a meeting, yes, 11 a.m. with the LG of Delhi. And then at 12 p.m. the Chief Minister will be meeting the Health Minister and Health Secretary of Delhi as well. Now the likelihood is that even though a full lockdown is not going to take place, the Chief Minister could be looking at other alternatives like weekend lockdowns, which could be a partial measure at this point of time, could help a little in controlling the cases, even though, of course, if you speak to experts, they never suggest lockdowns as the absolutely ideal measure, but considering a lot of people do go out on weekends, a lot of them might go to restaurants or malls, all the unnecessary or non-essential needs, people may go out for that, so that can be curtailed through a weekend lockdown. So that is an alternative that the Delhi government might look at, but hard to say things for sure at this point of time, considering everything will be on the table for consideration when both of these
Well, it is going to be an important meeting, Sukirti, that's going to take place, and we will, of course, keep a close watch on all those developments. Can one now expect some kind of weekend lockdown or curfews to be imposed in Delhi as well? That's the big question that everyone's asking. We'll keep a close watch on that story. Thanks for joining us. Let's now shift our focus. We have Dr. B.V. Manjunath. He's a Chief Interventional Cardiologist from the AJ Hospital and Research Centre, joining us from Mangalore. We also have Dr. Neerav Kumar, Additional Professor, IGIMS, Patna. Thanks so much, doctors, for sparing your time and being with us. We're, of course, talking about, Maharashtra and Delhi, which are presenting itself as extremely worrying in terms of the daily caseload. But let's also just look at the smaller places. States like Bihar, Uttar Pradesh also presenting themselves as worrying situations, exponential rise in cases in these areas. Dr. Kumar, if I can ask you first, are you worried at all about, the way cases are exploding in the state of Bihar, especially at the moment?
Definitely, ma'am. This time the surge is very fast. The infectivity rate, positivity rate is very high, and reproduction rate is also very high. And we have huge, large population. The migrants are coming back to our state. So if spread is very fast and very large number of patients turn up to the hospital, then our health system will collapse definitely, because in short period of time, large number of patients will create a huge problem.
Right.
That is a major worry for us. And this time, the younger population is dying. Like almost 30 to 40% patient which died yesterday was younger population in between 20 to 45 years of age. So this time the COVID is killing even without comorbid condition. So that is the main worry.
That's a very important point you're making. You're saying that COVID is proving to be fatal for those who don't have comorbidities as well, and also in fact attacking the younger population, for whom, remember, there is no vaccine yet available in India. Dr. B.V. Manjunath, what are you picking up? You're joining us from Mangalore at the moment. What are you picking up? How grim is the situation? And more importantly, respond to the point that Dr. Kumar was making. Is the virus behaving differently in different parts?
Thank you very much for inviting me. And of course, the second wave, which is happening this year, has a double mutant strategy, and it is more transmissible, as well as it spreads in the younger people more comparatively. So we have found a lot of young people getting affected this year. Last year it was the idea of protecting the elderly people with comorbid state. So that is the idea of Government of India vaccinating the elders first, and those below between 45 to 60 years with comorbid state. Now, what we are finding is that the new mutant, this is a double mutant which is happening, is infecting the younger people, and more of younger people are coming back to the hospitals with the infection, and so the behavior has changed as far as the mutation is concerned, and the behavior has also changed as far as the public is concerned.
Yes,
we are finding a lot of surges. Yesterday, only 1,027 deaths have occurred in India, and Maharashtra is surging.
Yes.
Karnataka is surging. Delhi has reported almost 17,000 cases yesterday.
Doctor,
so all over India is almost 1.84 lakh people got infected yesterday. So it is a
Dr. Manjunath,
situation.
I have to say that majority of experts who talk to us on the broadcast have put the blame, or rather more of the blame, on the behavior of individuals, who are of course to blame, but you actually squarely put the blame on the change in behavior of the virus as well. So I think there are two factors at play here, and both those factors need to be considered equally. Dr. Ravikant Patil also joins us. He's an interventional cardiologist and a professor of cardiology. He's joining us from Sangli. Dr. Patil, the big question is Maharashtra is in a lockdown-like situation for 15 days. Are curbs the only way to contain the spread of infection, to break the chain of transmission? Is that really the only option left for states which are seeing an exponential rise in cases like Maharashtra?
No, actually, what I feel is only two approaches for this new wave is educate and vaccinate. We need to educate people more and more to keep a social distancing and wearing a mask, and educate their behavior. And most importantly, we should vaccinate as early as possible. That is the only way left. In the last wave, which came in September, we didn't have hopes of a vaccines. But now we have hope of a vaccine. We have a mechanism to deliver a vaccine. Now this is a time to vaccinate large number of population as early as possible.
All right, so you're saying lockdown shouldn't be the approach should be to vaccinate, but we're still not vaccinating a large section of our working population, and there is still not enough supply to vaccinate the entire population. In that event, Dr. Rajneesh Kapoor is also joining us. He's an interventional cardiologist from the Medanta Hospital. Dr. Kapoor, are you concerned about the rapid rise in infections, especially in the national capital? There is a lot of pressure on the healthcare infrastructure. There's going to be an important meeting that's going to take place today. Do you believe that, enhanced curbs, a lockdown-like situation is the only option that we have?
Yeah, absolutely. So I think it's been extremely harrowing situation in past few days. All hospitals are flooded, they are loaded, there are no beds available in the Delhi NCR. And there are pictures showing the ambulances are waiting outside the hospitals, 20-25 ambulances, waiting outside the private hospitals to get the patient in. We are getting frequent calls from patients here and there that we want a bed, but beds are not available. So it's a harrowing situation, no doubt. And to manage the situation, I think is the only way out is that COVID appropriate behavior should be stringently in place by all responsible citizens. That's number one. We have talked about in detail in last few days, but still that's missing. That's the problem. And second, vaccinate. The only way we can put brakes to this is, I think we should expand the umbrella of vaccination. I'm sure government is taking all necessary steps, but if we ramp up and scale up the vaccination program further, maybe in a month or 2 months, we put the brakes to this expanding things. Otherwise, next month would be further harrowing. That's what I believe.
Right. Dr. Kumar, I want to come back to you at the moment because, you're of course joining us from Patna. But what is the situation? What are you picking up from, what's happening in remote parts of a state like Bihar, where COVID cases are rising rapidly? Is the healthcare system robust enough to be able to support this exponential rise in cases?
So, ma'am, there is problem with healthcare system. Even in a European country, you have seen that the Italy, the people were dying roadside because of overwhelming the situation. The rise of number are very high. The people were dying. Similar situation can happen to our country. Last time we survived because of the lockdown, because spread was not so rapid. This time, if spread is rapid, if rise of cases in short time of period, any healthcare system will collapse. That is the major problem, and definitely the healthcare system we should pay attention to healthcare system. Definitely we require defense budget, we require welfare budget, but healthcare system, investment in healthcare system, this is time to we should think about.
Well, you've heard from expert doctors joining us from different parts of the country. It's a grim situation that's playing out everywhere. This is a rapidly spreading mutant strain. It's more transmissible. Cases are rising exponentially. The healthcare system is, of course, overburdened at the moment. We're going to keep a close watch on all these developments. Thank you so much, doctors, for sparing your time and joining us this morning. We're going to slip into a very short break. We'll be back with more on the other side. Stay with us. Welcome back. It's a shocking story we're tracking from Shivpuri in Madhya Pradesh. A probe has been ordered after a family in Shivpuri has alleged that a COVID patient died after the hospital staff allegedly pulled out his oxygen support at night and gave it to another patient. The family alleges that the oxygen support was removed and given to another patient, which in fact did take place at this hospital. They also say that the administration initially denied any lapse, but now a probe has been ordered and a report will in fact be submitted in 48 hours after CCTV footage emerged as evidence.
ऑक्सीजन मैंने इनसे नर्सों से बोला, डॉक्टरों से, सर ऑक्सीजन लगाइए, सारी तरफ है, नहीं हम नहीं लगाएंगे, उन्होंने नहीं लगाया, मैंने लगाया और 10-15 मिनट में उनके प्राण निकल गए। इनने ऑक्सीजन हटाई है उनकी, इस कारण उनकी मृत्यु हुई है।
Let's go right across to Anurag Dware. Anurag, this is an absolutely shocking story. It's a huge allegation that's been made by the family. What are you picking up?
Yes, Rishika, really shocking. And you can see, I mean, in those visuals of the CCTV footage, COVID patient Surendra Sharma died in the district hospital in Shivpuri as the staff allegedly pulled out his oxygen support at night and no doctors visited him. The administration initially denied any lapse but later ordered the probe after the CCTV footage came out. His son, Deepak, also said that around 11 p.m. in the night he came out of the hospital, and when he reached there at around 8 a.m. in the morning on Wednesday morning, you can see his father gasping for breath, and then he took his father to the ICU, but later he died there. And when they insisted on the CCTV footage, because initially the hospital said nothing of that sort has happened there, but then when they insisted for the CCTV footage came out, and after that only the hospital ordered a probe. But the situation is really serious in Madhya Pradesh, as the COVID cases, daily cases are reaching towards the 10,000 mark, and at least 4 districts have run out of the ICU beds, including Damoh, which is out of the weekend lockdown and night curfew because of the impending bypolls. But other 3 districts also, Katni, Rajgarh, Tikamgarh, along with Niwadi, which has no ICU facility and depends entirely on the Tikamgarh district. These 5 districts have around 3,200 active cases, and you have also seen the situation in capital Bhopal and Indore. The situation is really worsening in Madhya Pradesh. Rishika?
Anurag, appreciate you for joining us with the details. It's a shocking story. The situation in Madhya Pradesh is grim. Anurag's also been reporting on how there is a shortage of oxygen supply across hospitals. We'll keep a close watch on all those developments. We're going to slip into a very short break, but coming up on the other side, we'll get you the latest India numbers. COVID cases in the country have breached the 2 lakh mark for the very first time. Over 2 lakh fresh infections reported in India in 24 hours. All the details on the other side. Stay with us. Well, breaking news that is coming in. India breaches 2 lakh coronavirus cases in 24 hours. This is for the 9th consecutive day that India is seeing over 1 lakh cases. It has taken India just 11 days to go from 1 lakh cases to 2 lakh daily cases. This is the big breaking story that is coming in. India's numbers continue to surge. At the moment, highest ever COVID-19 cases reported in the country. For the first time since the beginning of the pandemic, India has crossed the grim milestone of 2 lakh coronavirus infections. 2,739 cases reported in the last 24 hours. 1,038 people have lost their lives to COVID-19 in this period. Like I said, it's the 9th consecutive day of India reporting over 1 lakh daily cases. In fact, for 5 straight days, India has now reported over 1.5 lakh cases. Let's go right across to my colleague Sukirti joining us. Sukirti, this was anticipated, but India has crossed the grim milestone of over 2 lakh cases in 24 hours.
Well, yes, this was anticipated with the way the graph was going and the kind of figures that we'd already started receiving from different state health bulletins since last evening. But it is worrying. It is, and if you look at the ground situation in terms of the hospital infrastructure and how people are struggling to get even a single hospital bed, the situation is very terrifying. At this point of time, India's 5th consecutive day of reporting over 1.5 lakh cases, 9th consecutive day of reporting over 1 lakh cases. So just within the last 10 days, we have gone up from reporting 1 lakh cases daily to now 2 lakh cases on a daily basis. And the 2nd consecutive day that India has reported over 1,000 deaths. Our deaths were over the figure of 1,000 yesterday also. And if you look at the top 5 list, these states continue to be on their highest: Maharashtra, UP, Chhattisgarh, Delhi, Karnataka, all of them in terms of the highest cases being recorded. In terms of deaths also, it's again Maharashtra, Chhattisgarh, Delhi, Gujarat and Uttar Pradesh. UP again a big concern at this point of time, considering it's recording the second highest daily cases in India, and also going by the kind of population it has. They have huge numbers, and if the spike there is in control, then the situation could become on the lines of Maharashtra, and it could become very difficult for the state health machinery to take control of the situation.
So, Kirti, stay on with us. Let's get a reaction from Dr. Sumit Ray, the head of Department Critical Care Medicine, Holy Family Hospital. Dr. Ray, your first reaction. India has breached the 2 lakh mark for the very first time.
Sorry, I couldn't hear you very well.
I said, Doctor,
could you repeat the question, please?
India has breached 2 lakh daily cases for the very first time. It is indeed a grim milestone. Your first reaction?
Right, it's obviously extremely worrying, extremely difficult situation. Even at the ground level, we are finding it a logistically very, very difficult to accommodate patients. Our ICUs and our rooms for COVID are absolutely more than full. We are getting calls regularly, desperately looking for beds, and not just in our hospital, in most of the hospitals in Delhi NCR, and that's what I'm hearing about Mumbai too, and some of the other cities like Pune. It is a very, very scary situation. There has to be measures to really control the numbers. Vaccination is not the point right now to stop this surge. Vaccination is only for longer term. For now, they need more public health measures to control the numbers, to contain the numbers, and that is absolutely essential. Our systems are getting totally overwhelmed now.
Yes. Dr. Ray, when cases peaked in the first wave of COVID infections, cases didn't even breach the 1 lakh mark. Yet, in the second wave, we're seeing that cases have breached the 2 lakh mark. It's taken India just 11 days to go from 1 lakh daily cases to 2 lakh daily cases that we're reporting in 24 hours. How differently is the virus behaving in this second wave? What's your assessment?
Couldn't hear the last part of your question, sorry.
I said, how differently is the virus behaving in this second wave?
Has the virus?
How differently is the virus behaving in the second wave?
So, one is it is a much more rapidly infective virus. The R0, as we call it, is much higher. It is infecting people much more rapidly. That's why the volumes of infected people is much more. It's more younger people are infected because of one, the mobility of young people going to their jobs, etc. And probably to a certain extent, the older population has been vaccinated more. What we are also seeing that slightly the larger percentage of younger patients are having more severe disease this time. Overall, the case fatality rate of those hospitalized in most of the large centers is better than the previous one, but that will not be true if the systems get overwhelmed. If people who need hospitalization do not get hospital beds, there will be more deaths, and that is the really scary part.
We have Dr. Hemant Deshmukh, the Dean of the KEM Hospital, joining us from Mumbai as well. Dr. Deshmukh, it's an extremely worrying story as far as the numbers are concerned. This second wave of COVID-19 in India, cases are just exploding. We've crossed the 2 lakh mark in the last 24 hours. And if you just look at the comparison, the US took 21 days to go from 1 lakh daily infections to 2 lakh daily infections. Compare that to what's happening in India. India's taken just 11 days.
So what has happened in India is definitely worrisome. This is definitely, I think, COVID-19 version 2.0. And when this version started in the last week of February, the overwhelming number of cases have floored everybody. The tsunami of cases that is arriving in the intensive care unit, as well as the entire COVID centers in the state of Maharashtra and India, we just cannot manage them with the adequate number of healthcare workers that are present right now. People are still not realizing that this wave or the second wave of COVID is going to be more notorious. The virus is going to be more mutant, and people are just behaving inappropriately for the simple reason that they feel that vaccination is going to protect them. But the case scenario here is very different. What we are seeing is the patients who are getting admitted, are definitely from the age group of 15 to 35, and we have to protect the younger generation from COVID getting from bad to worse.
All right, so it is a worrying story as far as the numbers are concerned. What's even more worrying is the fact that younger population is also getting infected. Those who don't have comorbidities are also losing the battle to COVID-19. And remember, there's still no vaccination in place for those below the age of 45. Now, there are varying degrees of COVID-19 restrictions that have been put in place. Dr. Ray and Dr. Deshmukh, thanks so much for joining us with that input. But let's look at the restrictions, and are these enough? Let's go to Harsha joining us from Rajasthan, because Rajasthan on Wednesday night has announced an 11-hour daily curfew from 6 p.m. to 5 a.m. starting Friday across just the cities at the moment to combat this spike in COVID. Harsha, given the exponential rise in India, we know cases are rising in Rajasthan as well, but just look at the India number, over 2 lakh cases in the last 24 hours. Are these night curfews or varying degrees of curbs enough to stop the chain of transmission? That's the big question.
Absolutely. And, if you just look at the Rajasthan numbers also, there's been a huge growth. In fact, yesterday, Jaipur city reported 1,325 cases. That's a huge number. They've never reported more than 1,000. Also, Rajasthan reported 6,000 plus cases. The positivity rate has now become 15%. So in the first and second week of March, it was about 2%. And now, a month later, it's 15%. So that's really a huge growth. Now, what the government has done is, of course, there is a curfew, but, they've also said that there should be 50% workforce in factories, I beg your pardon, not in factories, but in offices. But is that really going to help? Because everywhere the COVID appropriate behavior is really not being followed. For example, today is the Gangaur festival, and many people could be having pujas where 20-30 people will attend. Having a curfew at night is really not going to help, because in the day also the transmission is happening, and markets are still a little crowded. The wedding season is also still on in Rajasthan, and though they've capped the number of people who can attend a wedding at 50, the people who go out for shopping for weddings are crowding the bazaars and the marketplaces, which is leading to this rapid spread of the virus.
Right, Harsha, appreciate you for joining us with that update from Rajasthan. So remember, there are varying degrees of restrictions that are gradually coming into place. It is still a micro-containment strategy that appears to have been employed, wherein restrictions are being put in place in areas where cases are rising. Let's also get in an update at the moment from Uma. All right, we'll be joined by Uma in just a bit, but we'll get you an update from Telangana in just a bit, because remember, the Telangana health director has warned that Telangana could very well be going the Maharashtra way.
రాష్ట్రంలో కరోనా కేసుల సంఖ్య విపరీతంగా పెరగడం మనం చూస్తూ ఉన్నాం. రాబోయే 4 నుంచి 6 వారాల్లో ఇలాంటి పరిస్థితులే ఉండే అవకాశం ఉంటుంది. ఇలాగనే మన పరిస్థితిని వదిలేస్తే మన తెలంగాణ రాష్ట్రం కూడా ఒక మహారాష్ట్ర అయ్యే పరిస్థితులు కనిపిస్తున్నాయి. అండ్ మన రాష్ట్రంలో కేసులు ఇలా పెరుగుతూ ఉంటే ఇప్పటికే బెడ్స్ దొరక్క కొంతమంది కొన్ని హాస్పిటల్స్ లో ఇబ్బందులు పడుతున్నారు. రాబోయే రోజుల్లో ప్రభుత్వం ఎన్ని రకాల చర్యలు చేపట్టినప్పటికీ, ఎన్ని బెడ్స్ అరేంజ్ చేసినప్పటికీ ఇలాంటి ఇన్ఫెక్షన్స్ కంటిన్యూ అవుతూ ఉంటే బెడ్ దొరకలేని పరిస్థితి వచ్చే అవకాశాలు కనిపిస్తున్నాయి. కాబట్టి ప్రభుత్వం లాక్డౌన్ వైపు కానీ కర్ఫ్యూ వైపు కానీ వెళ్ళట్లేదంటే పరిస్థితులు తీవ్రంగా లేవని చెప్పేసి కాదు, పరిస్థితులు చాలా తీవ్రంగా ఉన్నాయి.
Right across to Uma Sudhir joining us. Uma, we just heard from the health director of Telangana, but just look at the exponential rise in COVID-19 infections pan-India. India breaching the 2 lakh mark for the very first time. There are varying degrees of restrictions now that are being put in place. But what's absolutely shocking is that large congregation at the Kumbh continues. No stop yet to any kind of political rallies. There is a by-election taking place in Telangana. There are panchayat polls taking place in Uttar Pradesh.
Absolutely. Telangana's health director, in fact, has put out a very, very dire warning about the kind of situation that is prevailing in Telangana. If you see the average over the last 14 days, in fact, the rise has been 338%, which is really very, very worrying. And three important things that the health director is saying. He's saying that Telangana is headed the Maharashtra way. Two, the fact that the virus now is spreading very rapidly and very fast, and therefore people have to be extra careful. And even though the lockdown has not been announced in Telangana, he says the situation is not far from dire at all. It is more than dire, and it is the worst it has been in the last more than 1 year of the epidemic. And he says people must in fact wear the mask even inside their homes if they don't want to infect their family members, because the observation now has been that inside the families, when somebody from who is exposed to the virus comes in, within a few hours or in even a day or two, the entire family is getting infected, and therefore he's saying that the virus is now airborne. That's of course a very important thing, that announcement that he said, and he's saying that that's the reason why people must wear a mask even inside their homes if they want to protect their dear ones. And yes, he's also speaking about the fact that despite the best efforts of the government, right now already there is a bed shortage that has started, and he says that situation is going to get worse if we are not going to act responsibly right now. This is coming, as you mentioned, yes, at a time when there is a Nagarjuna Sagar bipole that's to take place on the 17th of April, and there all political parties literally, as elsewhere in the country, are not observing social distance. They are gathering huge crowds. People are coming without masks. And the situation certainly is looking to take a turn for the worse. Of course, this also comes at a time when we are expecting that the Telangana government may follow the cue of the CBSE and also cancel 10th class exams and perhaps reschedule 12th class exams, which are in fact Telangana board used to start with them from the 2nd of May. Back to you.
All right, Uma, appreciate you for joining us with the very latest. We will keep a close watch on the India COVID story. We'll also keep a close watch on what are the decisions that are being taken across different states in terms of imposing curbs and curfews. We'll bring you all the latest on the other side of a short break. Stay with us. Welcome back. India is seeing the highest ever surge in coronavirus cases. Over 2 lakh cases have been reported in the last 24 hours. Let's get you a live update from Jammu and Kashmir at the moment, where there have been over 1,000 cases in 24 hours. And Nazir joining us with the very latest. Nazir, the Ramadan fasting has in fact hit the COVID vaccination drive. This is indeed worrying.
Yeah, exactly. And officials are saying they are trying to send the message across that there is opinion and the fatwa from the Islamic scholars across the world that it will not, if you take a vaccine injection, it will not invalidate your fasting, dawn to dusk fasting. But what has happened? On the first day of Ramadan in Jammu and Kashmir, against on average 65,000 doses, in Jammu and Kashmir, only 31,000 doses were administered. So only 31,000 people came forward across Jammu and Kashmir and took the vaccine yesterday, which is more than 50% drop in vaccination on the first day. So will it pick up? Because officials are saying, look, we're sending across social media and other means using the religious leaders, telling people, look, vaccine injection will not invalidate your fasting. Take the vaccine during the Ramadan. Muslims observe dawn to dusk fasting, and they don't take water, they don't take food during the day, and they believe this vaccine may also invalidate, it may break their fast during the day. Now there are two options. One, they are saying to spread the message and get people back to vaccination, or devise a mechanism of where they can give vaccines after evening when people break the fast. But then there are late evening prayers. That is not an easy option. So what officials are saying, they are sending a message. Awareness is the key. The first day has actually seen witness for 50% drop in vaccination in Jammu and Kashmir, just 31,000 against 65,000 on Tuesday.
All right, Nazir, appreciate you for joining us with the very latest. So, Ramadan fasting there hits COVID-19 vaccination drive. There's been an over 50% decrease in vaccination. We'll keep a close watch on all those numbers. Meanwhile, we will, of course, continue to get you the very latest in terms of what really is the government strategy going forward. Will micro-containment continue to remain in place? Remember, India has breached the 2 lakh mark. 2 lakh daily infections for the very first time. That's all we have time for on Good Morning India. We'll return with more news on the other side. Stay with us.